Welcome to the deep dive. We sift through all that information overload to bring you what you really need to know. Today, we're tackling something that can feel, well, incredibly overwhelming. Navigating a cancer diagnosis.
Right.
Specifically, preparing your home, your daily life. You get so much advice, right? Well-meaning people, ads everywhere suggesting you need this huge arsenal of stuff. But our deep dive into the sources, it tells a different story, a really liberating one, actually. You likely need far less than you think. And the right things, often much simpler.
That's exactly it. That's our mission today. We've looked at tons of research, patient stories, expert advice to really curate a practical, focused list. The goal isn't to add more stress, not another shopping list. It's about finding those items that genuinely bring comfort, boost safety, make those daily challenges just a bit more manageable.
Yeah.
We want preparation to reduce stress, not pile it on with clutter and cost. Simple, effective tools, things that give you back some control.
Exactly. Control is key. So to guide you through this, we've structured our deep dive. Makes sense, right? We'll start with a universal toolkit. Think of these as the essentials, useful no matter what stage you're at. Then we'll get into specifics. Before and after surgery needs, coping with chemotherapy, then the skincare for radiation, and then, importantly, we'll talk about what you probably don't need. Cutting through that noise, it's kind of a roadmap for smart, less stressful prep. Okay, let's unpack this universal toolkit first. These aren't like high-tech gadgets. They're the basics that our sources kept highlighting. Things for comfort, organization, useful all the way through, no matter the treatment plan. It's like setting up your command center for your health.
Yeah, and the interesting thing here is how these really simple items become such powerful tools for empowerment, really. Take a binder or a notebook. Seems basic, right? But it becomes your command center. Our research showed patients who kept things organized, appointment cards, lab results, questions for the doctor. They felt way more in control, less overwhelmed.
That makes total sense.
So just a simple 3-ring binder, dividers maybe, keep appointment cards, results, team business cards, that list of questions, it's all right there. No scrambling.
That organization piece, yeah, that really hits home when you're juggling so much new information.
Okay.
And related to that, the medication station, you said it's non-negotiable. Our sources really emphasized this wasn't just convenience, it's safety. What's a common mistake people make that this setup helps fix?
Oh, that's a great point. One of the biggest issues we saw patients run into is just losing track. Did I take that pill? Especially when you're tired, right? So a dedicated station helps prevent that. A clear pill organizer, the days of the week kind. A master list of meds, keep it updated. Dosages, times, and just a safe, specific spot for all medicines. It just clarifies things, cuts down on errors, big time.
Clarity.
Yeah.
And beyond organizing, there's comfort. The sources really hammered home the impact of clothing. Sounds simple, but comfortable, loose-fitting clothes are huge. Not just about being cozy, though.
Exactly. Not just cozy, it's about managing specific things that come up. Soft fabric, sure, cotton's good. But our deep dive, it showed materials like bamboo or modal were often mentioned as surprisingly great, especially for night sweats or chills. Chemo, hormone therapy can cause those.
Oh, interesting.
Yeah, they're super breathable, wick moisture away. So zip front tops, button downs, pull-on pants with gentle waistbands, soft robes. They minimize irritation, allow for swelling, make things easier when you're tired or sore. It's a small thing, but functionally makes a real difference.
And speaking of physical stuff, treatments are so drying. The research we saw kept pointing to a good moisturizer and unscented lip balm, like constant companions. But again, there's a detail there.
Absolutely. Moisturizer, think thick, creamy, and crucially unscented. That's key. Brands like Eucerin, Cetaphil, Aquaphor often get recommended. No perfumes, no dyes that can irritate sensitive skin, because chemo, radiation, even some targeted therapies, they can really mess with your skin's natural barrier, makes it vulnerable.
Okay.
And for lips, unscented lip balm, a must-have to prevent chapping. Dehydration and meds make that worse.
Hydration leads right to the next thing. A reusable water bottle. But the straw? That's a must-have. Why the straw, though? Just convenience?
It's more than just convenience, actually. Sure, it makes drinking easier when you're resting, maybe lying down, feeling weak. But critically, mouth sores. Mucositis, it's a common, really painful side effect of chemo for a lot of people. Sipping through a straw can help bypass those sore spots, makes it less painful to stay hydrated.
Oh, okay, that makes sense.
And on the topic of critical monitoring, A digital thermometer, absolutely crucial. Our sources really stress why that 100.4 Fahrenheit or 38 Celsius mark is so vital during chemo. It's not just any fever. It's often the first sign, maybe the only sign, of neutropenic fever. That's an infection that can get serious fast because your immune system is down.
Wow. Okay.
So you need a reliable thermometer, need to know how to use it properly, because that reading, that triggers an immediate call to your oncology team. No waiting.
That's a fantastic explanation of the why behind these things. Super helpful. And lastly, something easy to forget. A long phone charging cable, like 6 feet, 10 feet. Keeps your phone or tablet nearby, right? Hospital bed, recliner at home, just when you don't want to move. Small detail, big difference for staying connected, entertained, without a struggle.
Yeah, these basic things, they sound mundane, maybe, but they really do streamline daily life, reduce anxiety, give you that control over info and comfort. They're the foundation, really.
Okay, so building on that universal foundation.
Yeah.
Let's turn to surgery, prep, and recovery. The sources highlight some really critical steps you can take beforehand, things that can make the difference between smooth sailing and, well, a really stressful time. What was maybe one of the more surprising but really impactful recommendations for this stage?
That's a good question. So much of surgery prep is proactive safety, right?
Yeah.
One thing that kept popping up is surprisingly valuable, especially maybe for older folks or anyone with mobility issues, was a grabber tool, that simple mechanical claw thing.
Oh, yeah.
Patients consistently said it was a lifesaver. Picking up drop keys, the remote, whatever, without bending, twisting, reaching. All that puts painful strain on incisions. Simple fix for a common problem.
I can totally see that. Prevents a lot of unnecessary movement, potential strain.
Mm-hmm.
And speaking of preventing injury, bathroom safety. Sources advise thinking about this before surgery. A fall after surgery,
Right.
that can be really bad news. What should people look at?
Yeah, the research was clear. A post-op fall isn't just an oops. It can mean going back to the hospital, serious setbacks. So thinking ahead about a sturdy shower chair, maybe a raised toilet seat, definitely non-slit bath mats, it cuts that risk way down. And it's not just for people with long-term issues. It's for anyone recovering from major surgery. Pain meds can make you unsteady. Getting this stuff in place before saves a lot of stress and potential harm later.
Right, proactive. And another simple aid, maybe overlooked, pillows. Not just for sleeping, are they?
No, not at all. Pillows are surprisingly versatile, really critical, actually. Sure, elevate legs, reduce swelling, good for circulation, comfort. But what really stood out in patient feedback was using them for splinting.
Splinting.
Yeah, like bracing your abdomen. When you need to cough or sneeze or even just stand up, you gently press a pillow against your incision. It acts like a little shield, reduces the strain, the pain, protects those healing tissues. Big help. And a wedge pillow can make sleeping more upright, much more comfortable, sometimes necessary after certain surgeries, or just to manage discomfort.
And internally, let's talk about that. Anesthesia, pain meds.
Yeah.
They often cause constipation, right?
Yeah.
Sources strongly suggested having gentle over-the-counter stool softeners ready. But like with any medication, there's a catch.
Absolutely. Having something gentle like docusate sodium on hand is smart. Prevents straining, which can be uncomfortable and even dangerous after surgery. However, and this is critical always check with your surgeon before taking anything, even over-the-counter stuff.
Right.
Your team needs the full picture. Avoid interactions, complications. And for those first few days home, stocking the pantry is smart too. Easy to digest foods, broth, soup, yogurt, oatmeal, crackers, stuff like that, your go-to items. These are all steps to ensure a safer, more comfortable recovery, minimizing potential problems.
Okay, let's shift gears now. Chemotherapy. This brings its own set of challenges, right? Managing side effects, nausea, mouth sores, fatigue, that heightened infection risk we mentioned.
Right.
What's maybe one area where a really simple change can bring unexpected relief for patients?
Yeah, chemo comfort often comes from small, smart adjustments. For example, our sources really highlighted the impact of just using an extra soft toothbrush and a gentle, alcohol-free mouthwash. Gums get super tender, bleed easily sometimes. A regular brush can feel awful. So soft bristles are essential for keeping your mouth clean without irritation. But just as important is what you rinse with. Those commercial mouthwashes, the ones with alcohol, they can burn. Dry out your mouth even more, make existing sores worse.
Ouch.
So the sources strongly suggested a simple rinse. Teaspoon of salt, teaspoon of baking soda, and about 32 ounces of warm water. Super gentle, really effective for oral health without adding irritation.
Okay, avoid that alcohol burn. Makes sense. And nausea, of course, that's a big one with chemo. Beyond the prescriptions doctors give, what can people keep handy to, help settle things down?
Right, for nausea. Bland, easy-to-eat snacks are your friend. crackers, toast, pretzels, applesauce. Keep those around. They generally help settle an upset stomach. And what's interesting is how many patients in our research found natural things helpful for mild nausea. Not replacing meds, but for taking the edge off. Ginger chews, ginger ale, the kind made with real ginger, check the label, or peppermint tea, often cited as surprisingly effective for that queasy feeling.
And here's a really surprising one, maybe people don't think of it, plastic utensils. Sounds so minor, but our deep dive showed it matters. Why is that?
It's a perfect example of a tiny change, big impact. Chemo can cause something called dysgeusia, basically distorted taste. Often it's like a constant metallic taste. Yeah. It can make food eaten with metal forks or spoons taste awful, even inedible for some folks. So, switching to plastic or maybe bamboo utensils, it's a simple fix. Bypasses that metallic taste. Makes meals more tolerable, helps keep nutrition up.
That's a brilliant practical tip.
Wow.
And for hair loss, which is common with many chemos, what essentials did the sources point to?
For hair loss, yeah, a cozy hat, a scarf, a beanie, they become really important. Your head can get cold easily, especially at night or in air conditioning. Makes sleeping hard, a soft, seamless cap, much more comfortable for sleeping. And lastly, maybe most critically, because the immune system is weakened during chemo. Hand sanitizer. Infection prevention is huge.
Crucial.
Our sources really stressed putting alcohol-based sanitizer, like at least 60% alcohol by doors, in your car, in your bag. For when soap and water aren't around. It's a simple habit, but a powerful layer of protection against infections.
These are all really practical ways to lessen those daily discomforts of chemo, right? Lets you focus more on healing, less on battling side effects you might be able to manage.
Right.
All right, moving to radiation therapy. Different challenges here. Mainly skin care, right? Sources described it like managing a pretty significant sunburn. This is where following medical advice precisely is just non-negotiable, isn't it?
Absolutely is. That treated skin needs specialized, really diligent care. Minimize discomfort, prevent complications, help it heal. Our research hammered this home. Use extremely gentle, unscented soap, super important. Mild cleansers like unscented Dove, Cetaphil, even baby soap. They don't have the harsh chemicals, dyes, fragrances that irritate fragile skin. And when you dry, gently pat the skin, never rub, avoid friction, avoid more damage.
Okay, no rubbing with the towel. Got it. And moisturizing, not just any old lotion will do. Sources were specific here.
Extremely specific. You should only use what your radiation oncology team tells you to use on that treated area, period. The reason is radiation disrupts the skin's barrier, makes it vulnerable not just to irritation, but infection too. Standard lotions might have stuff like alcohol, alpha-hydroxy acids, retinol, things that can make it much worse. Often they suggest thick emollients like Aquaphor, maybe Myoderm, or pure aloe vera gel. But check that aloe. No alcohol, no additives. Your team knows best for your situation.
And what you wear matters too, I bet, especially with sensitive skin.
Oh, definitely. Soft, loose, natural fiber clothing. That's key. Think old, soft cotton t-shirts, loose garments that won't chafe the treated spot. Sources explicitly warned against like starched collars, underwire bras, tight waistbands, anything abrasive that could rub and irritate. Comfort here really helps healing, helps you move without pain. And finally, sun protection. This becomes like a permanent thing, that treated skin. Stays super sensitive to sun, often forever.
Wow, forever.
Yeah. So wide-brimmed hat, high SPF, broad-spectrum sunscreen, essential items. But remember, the sunscreen usually comes after radiation is done and the skin's healed. Your team will guide you on timing.
These are very specific, very critical steps then. Protecting that vulnerable skin, soothing it, minimizing discomfort, helping it heal during and after radiation. Okay, now let's move into a different phase altogether. Survivorship, ongoing wellness. After active treatment ends, your needs shift quite a bit. Focus moves to rebuilding strength, monitoring health, embracing what can feel like a new normal. What's an important question that kind of emerged from our research about this transition time?
Yeah, this phase is about shifting from active treatment to, well, active living. And it raises this key question. How do you empower yourself during this really complex time? The answer, according to our sources, often involves taking an active role, monitoring your health, processing your emotions. For instance, something as simple as good walking shoes. They encourage gentle, regular movement, which is one of the best things for physical recovery and mental recovery. Investing in comfy, supportive shoes can really help you get moving safely, consistently, build a routine that supports long-term health.
And taking an active role also means having some basic tools at home, doesn't it, for monitoring?
It does, yeah. Research highlighting the value of having, say, a blood pressure monitor and a scale at home. Lets you track your own metrics. That can be incredibly empowering. Plus, it gives your care team good, consistent data during those follow-up visits. It's about being an active participant in your health journey, not just passively receiving care.
And emotionally, that time after treatment can be so complex. Relief, sure, but also new anxieties, maybe big reflections. What tool did sources often recommend for navigating that?
A journal came up frequently as a really powerful tool for processing all those thoughts and feelings. It's a private space, right? Helps organize thoughts, maybe identify triggers, track how you're doing emotionally. Many patients found it invaluable for dealing with grief, fear, gratitude, just the whole mix of feelings that come up after treatment. And practically, with all those follow-up appointments, scans, blood tests, part of long-term surveillance, a big wall calendar, pretty essential. Keeps everything organized, visible. These tools, they support both the physical side and the emotional well-being, help you navigate that long-term survivorship journey with more confidence, more clarity.
So what does this all boil down to? When we think about what you actually need versus what you think you need or what people tell you need, we've talked about what helps, but just as important is knowing what not to get. Reducing stress, reducing clutter. This is where our deep dive really tries to cut through that marketing noise.
Exactly right. The core principle, and patient experiences back this up, is that the goal is comfort, safety, peace. Not just collecting stuff. Discernment is key. Like those expensive immune-boosting supplements or powders, be super wary. They're often unregulated. And crucially, they can actually interfere with your treatment or other meds, maybe make them less effective or cause bad reactions. Our deep dive was absolutely clear on this. Never add a supplement without checking with your oncologist first. Explicit approval. It's tempting, but potentially dangerous.
That is such a critical warning. Cannot stress that enough. And another thing people might assume they need, but often don't. A hospital bed at home.
Yeah, exactly. Unless your medical team specifically says you need one for like a complex mobility issue, your own comfy bed, maybe with some extra supportive pillows, usually much better. People assume they need one for recovery, but often it just adds expense, takes up space, makes your home feel less like home. Stick with comfort and familiarity if you can.
And finally, that urge to stockpile. Get everything just in case. What did the sources say about loading up on supplies?
Yeah, our research consistently found that building a massive stockpile, often counterproductive. Your needs can change pretty quickly, or a product you thought sounded great might just not work for you. Much better to buy, say, one package of wound care stuff, or one tube of a new cream. Try it out. You can always get more if it's useful. But buying in bulk can leave you with tons of unused things. They become clutter, maybe even unwelcome reminders. Add stress, not peace. And those fancy chemo care packages online. Our deep dive found they often have redundant stuff or products that might even irritate sensitive skin, often an unnecessary expense, not a real comfort.
Right. This section is really about empowering you, isn't it? Make informed choices, skip needless spending, keep your space calm, focused on what genuinely helps. Wow, we've covered a lot of ground today, really navigated the landscape of the cancer diagnosis, haven't we? From those universal tools that command center idea to specifics for surgery, chemo, radiation, right through to survivorship support. And maybe just as vital, shedding light on what you can probably skip, cutting through all that noise.
Yeah, our deep dive today was really about bringing clarity, empowering you. The main takeaway, it's not about getting stuff. It's about creating an environment of comfort, safety, and peace. Use this list as a starting point, a guide. But always, always listen to your body. And most importantly, talk to your care team. They're your best resource for tailoring any advice to your specific journey.
Absolutely. Couldn't agree more. And as we wrap up, I want to leave you with this thought to chew on. Considering how much unnecessary clutter, how much information overload we deal with in life generally, what other areas could benefit from this same kind of deep dive approach? Identifying the real essentials for well-being, for peace. Take that discerning mindset we talked about today. See where else you can simplify. Focus on what truly serves you. Thanks for diving deep with us.